Everybody, Dr. Rob Silverman here. Facebook Live, as you know, really good information about a shoulder injury. 8 out of 10 women at some point in their life will have a shoulder rotator cuff injury impingement. Men typically have that. The people that are more exposed or have a higher incidence of them are people that do a lot of overhead lifts, those who are a little more buxom or round shouldered, the heavy bench pressers. They put themselves in an ergonomic position that will, unfortunately for them, enable them to have a rotator cuff. Understand the first things that happen is you have some sort of rotator cuff tendonitis or impingement. So is it impingement or rotator cuff injury? If you have a rotator cuff injury, you will have an impingement. If you have an impingement, you have a rotator cuff injury. So here's my little rotator cuff. And this is the front. There's your clavicle. There's your humerus. Here are your rotator cuff muscles. 4 rotator cuff muscles: supraspinatus, infraspinatus, subscapularis, and teres minor. Subscapularis right here on your subscapula, scapula, your shoulder blade. So you would be looking right through me if you had x-ray vision like Superman. From the back or posterior, here is your supraspinatus. Here is your infraspinatus, and here is your teres minor. Your subscapularis helps you with internal rotation. Your supraspinatus helps with abduction, elevation, and external rotation. Infraspinatus and teres minor have a dual purpose. They're external rotators. They all come to the front part, right on top, where you see all these fibers this way. 1, 2, 3, and 4 all come to the top of the humerus to form what we call the rotator cuff. The rotator cuff muscle, the key ingredient to that is to stabilize and depress the humeral head. Without it, you'll come up here. So if you have any kind of tendonitis, tendinosis, or tear in any one of these muscles, your humerus, if you guys can see, elevates. That causes an impingement. If you have what we're going to go over later, an intrinsic pathway that causes an impingement like this, pressing down on your acromion, you're going to get a rotator cuff injury. So with that being said, the people who are, once again, very exposed to an increase in rotator cuff injuries are those who do overhead lifts, those who have a postural fault, athletes, women as you age, and also ergonomic positions that aren't really efficient, once again, for that shoulder. Some of the bigger problems I see with rotator cuff or the misses is people don't understand the neck and the shoulder are really truly one functioning unit. So if you go to the doctor and you point at the shoulder and you say it hurts right here, it may, but the big takeaway there is that the body's all interconnected, and he who treats the side of pain in functional movement is truly lost. 17 different muscles insert on the scapula that can refer to the front here. One also addition right here, like this, is your bicep. So you have a bicep that can get injured, that adversely affects your shoulder. The bicep's very interesting in that the tendon up here also works with the labrum. So as an FYI. Lastly, your lat comes this way and wraps around, and your lat dorsi, a very long, strong muscle, also can adversely affect the position of your shoulder. And once again, your neck and shoulder are truly one functioning unit because muscles here go from the shoulder over the acromion to the neck. So please, whenever you go to see anybody or you come to my office, let me show you and let me evaluate you, or have somebody like a chiropractor, physical therapist, any kind of movement expert, orthopedist even, make sure that they examine the whole region. Otherwise, they're going to miss something. Remember, looking in the mirror gives you a reflection of where you are today. Looking behind the mirror really gives an idea of how deep and involved and interconnected the body can become. So let's move to the summary of extrinsic pathways of rotator cuff tears. Very, very interesting. Extrinsic, from the outside. You can have a down-sloping acromion, and we'll go through this, acromial spur, AC spur, and lateral extension of the acromion. This all leads to an intrinsic compression, which is leading towards degenerative cuff. So, once again, I'm taking the muscles away and just adding some ligaments so everybody can see what's going on. Here's your acromion. It's part of your scapula. So we talked about down sloping acromion. There's 3 types of acromion. The one like this is flat. type 1. Then there's one that's curved, type 2, that will nick the rotator cuff, and type 3 is beaked. It's all the way down, it's a bad day. You would have to get an MRI to ascertain what kind of acromion you have. However, with the downsloping damaged acromion, I happen to have a type 2, you have a more propendency towards rotator cuff injuries. Also with this, all the different ideas that you have this extension on making an imaginary bone, grabbing the muscles here, so when you move, you wear away. You get compression. One of the things I added was scapula. 100% of people who have a damaged rotator cuff or shoulder injury have something called scapular dyskinesis. The scapula is not moving or in an improper position. So now you're looking at the individual from the side. So if their posture is bad or they're round-shouldered, look what the scapula does. I'll go here. Look what the scapula does. You just got a shoulder impingement. So you look from behind, and if the scapula is moved in this manner, guess what? You now have a shoulder impingement. Look what the scapula is doing. The position of the scapula, or scapular dyskinesis, it doesn't move well, is a critical element, the critical element for overall rotator cuff health pertaining to extrinsic type of injuries. They call this degeneration because it's rubbing, it's degenerating, it's picking away. This is something that I like to say can be positively affected with a great clinical outcome from manual rehab and chiropractic. Because what you're going to see in this video is rotator cuff injuries should be addressed with manual rehab and nutritional biochemistry. Here's your manual rehab. So what things would we do to help the scapula or with the muscles not to have the extrinsic compression? Cannot change if you have a spur. Cannot change it. Operations are not an answer. Cannot change it. We can only position it in the best ergonomic manner. In addition, what can we do? Well, we can soft tissue the muscles. So what do I like for soft tissue of the muscles? Fascia, tendons, and ligaments. Here we go. Active release technique, a great choice. Factor. Todd Riddle does a great job with the factor. You're enabled to break up muscle adhesions and open up the fascia. Great option. Exercise rehab, critical element. So exercise rehab, places I recommend as always are web exercises. And one of the biggest things and the new things that I've seen out there is the ability to reposition your scapula to give that kind of distance. That would be motion guidance. Motion guidance takes visual acuity and enables the visual acuity to keep that patient's eye in a spot as they get proprioceptive feed. A critical element. Hey, guess what? Manipulation. Chiropractic manipulation. 80% improvement from a thoracic adjustment with an increase of shoulder range of motion. Don't be afraid to have somebody adjust your thoracic spine. It is still a very, very powerful tool. What's interesting is, remember there's 4 joints in this area. All 4 joints leave a 1/4 of an inch. That is about a 1/4 of an inch in the subacromial space. Any change in these joints does not give you enough space, leading to this extrinsic compression, leading you down the road to degenerative rotator cuff injury. So with that being said, let's move on to a summary of intrinsic pathways of rotator cuff tears. This is very exciting. This is where you see your nutritional biochemistry. Number 1, you see degenerative microtrauma theory. Now I'll try and get everybody to see this, but here we go. What do we have? Oxidative stress. What's oxidative stress? Too many free radicals, injuries in the local area. Also when muscles are tight, we have something called hypoxia. Oh, my muscle's tight, you know, it aches. Not enough oxygen. That not enough oxygen gives you 2 options. You can go to cell death and reduced cell function leading to tendon degeneration, or you can have increased ROS, reactive oxygen species. There are 5 different kinds of that. Those are a free radical type of thing, and they lead to the expression of MMPs, matrix metalloproteinases, your body's own proteolytic enzymes. Literature has shown that the increase in matrix metalloproteinases are the #1 reason for failed rotator cuff surgeries. Matrix metalloproteinases are expressed at the time of injury. They come out and eat healthy collagen. So your body's eating itself. That's a major issue. So matrix metalloproteinases are showing that the body's going from like a tendinitis to a tendinosis to tendon damage and pathy. So we have to modulate the expression of MMPSs because they damage extracellular matrix. Extracellular matrix is everything outside the joint. Is in that it is cartilage, ligaments, tendons, muscle, and fascia. So with that, we're speaking to that concept right there. You need to modulate that because the expression and the modulation of a extracellular matrix will lead to a healthy outcome. Interestingly enough, extracellular matrix communicates with the whole body. It's an intracellular signaler. So when you damage your soft tissue like this, when you damage your soft tissue, you're actually stimulating a systemic inflammatory problem. So anybody who's treating anyone musculoskeletally is also helping them systemically. So another answer is he who treats the site of pain in functional nutrition, functional medicine is lost because that injury isn't just here, it's through the whole body, and the patients need to know that. Let's back this up one more time. So you have oxidative stress, here's your degenerative microtrauma theory, reduced cell function, tendon degeneration, all leading towards degenerative tear. What about suboptimum cuff vascularity, not enough blood flow? You know, we always look as chiropractors, we look at a tight muscle. We don't talk about the oxygen enough. You know, what we discussed here in the idea of oxidative stress, we don't talk about vascularity. We don't talk about when something's tight, it's not getting a proper blood flow. So suboptimum vascularity, things aren't going to heal as well. We've got to free up those things. So what would I recommend nutritionally to help with this intrinsic theory? Well, I use a product that has specific herbs and nutrients to help modulate the expression of extracellular matrix. In addition to those, I would recommend proteolytic enzymes and specific amino acids like glycine and lysine to help collagen build up. Shocking as this may seem, I would always recommend treating the gut because if the gut is compromised, you can have systemic inflammation and a release of matrix metalloproteinases. So you can really see the summary of intrinsic pathways of rotator cuff tears and extrinsic pathways lead towards rotator cuff injuries. Be very precise. Here's a quick treatment protocol. Just assess, adjust the areas. Soft tissue with any technique that you like, myofascial release, active release. Instrument-assisted techniques like factor, without question. In addition, the exercise regimen and things you can give at home gets applied by web exercises. In office, something really cutting edge, motion guidance, and of course, nutritional protocols for the gut, overall systemic health, and the concept of the intrinsic theory looking towards that extracellular matrix. I got a couple of requests for some upcoming Facebook Lives. Do me a favor, everybody. Why don't you IM me? Let us know what you want. We will be answering this. I got this as a request, so we'll be following your request. We may even be doing 2 Facebook Lives. Real good information I hope I shared. Work real hard to get it to you. Share it with your friends. Just punch share. John, do you have any questions?
Yeah, a couple of preventive strategy questions. For someone who's active in the gym and is doing a lot of pushing exercises, bench press, shoulder press, what can they do to sort of keep that body balanced and protect their rotator cuff?
Great question. Well, when you're in the gym and you're lifting heavy weights, we're going with what we call show muscles. You know, that looks good. So I'm big on doing a lot of preparative type of exercises, like I can show you in an upcoming video, to stabilize the rotator cuff, in and out, above the head. Also, once you get those stability muscles, so you can now use those show muscles, I call stability muscles go muscles, positioning of the weight. So for instance, bench press, not wide, you should be what we call 1.5 times your biochromial width. So basically just enough space so your elbows, not here, but can just pass your shoulder. Really wide, shoulder impingement, damaging. Declines benches also have a problem because when you push up. Overhead presses, fine. Make sure you can put your arms above your head, because if you're pressing like this, look at the angle, you have to go straight above the head. So those are 2 things that I would strongly recommend. Also, when you're lifting overhead, I'm not a big proponent of holding it overhead for too long a period, because that's a snatch.
And athlete-wise, baseball players, people who are throwing quite a bit, obviously they have a lot of rotator cuff injuries. what are some of the things they can do to prepare their arm and shoulder for that throwing motion?
Well, I can tell you that with the quarterbacks and the baseball players like a Derek Jeter who used to play shortstop, Tom Brady as a quarterback, they're not lifting weights overhead. They're doing mobility overhead. They're not going to take a chance to injure themselves in a gym. So careful with the throwers, careful with the tennis players and the servers. Their power for those people going overhead is truly going to come from the stability in the shoulder area and the strength in the core area and the hips.
Cool. How can people find you?
Guys can find me. You got my Facebook. Please share it. 311 North Street, White Plains, New York. Info at Dr. Robert Silverman. And hope to see you soon. Always yours in health.